Hello, my name is Dr. A S Menon-Johansson, the founder and director of Contact Virus Tracker CVT. Now, CVT's strategy for addressing the COVID-19 pandemic is to slow the rate of transmission by speeding up access to testing and treatment and supporting the medical community to work effectively together. And we do this through anonymous contact tracing that comes from our platform, and then we digitally triage those contacts that are informed and then support them to get tested by linking them to care with targeted appointments. And our software supports the healthcare workers to work effectively with patients to deliver this really important service. Contact tracing by CVT uses 6 steps. And the first step is to capture the unique patient ID of the person with the diagnosis so that they can reference back to their own records. The second step is mass notification. And this is for all of those patients who have a diagnosis when there are multiple people could have been exposed, such as in the classroom or a passenger on an airline. And what we do in this software is we identify the circumstances of the patient. We then capture the venue, the date and the time of the exposure. We then put in the information of the organizer who can cascade this information to contacts. And we have a set email that goes to that person with the text that they send to the contacts with a unique link that links back to the patient. We also do one-to-one contact tracing. And that's when the member of the healthcare team is speaking to the person with the diagnosis. And they can identify who needs to be told, and then they can capture their name, their mobile number or email address, the venue, date and time of the exposure, and then they can send them a message that goes directly to their mobile phone. And once it arrives on their mobile phone, when their contact clicks on the link, our CVT system then digitally triages them to a local testing venue. We also work with the patient so that they can deliver contact tracing. And the way that CVT does this is that we make sure that patients know who to identify as a potential contact in terms of 2 days before symptoms or in the last 2 weeks if they have no symptoms. And then we send them a link that goes to their mobile phone and allows them to tell as many people as they wish using CVT. Again, it's anonymous. And the reason why we empower patients like this is sometimes they're reluctant to tell all the potential contacts, or they just don't remember at the time of the conversation about contact tracing initially. And then the message goes out by SMS or email. And we also support them to use social media as well. So we give them advice again on who they should tell, and then we provide them with a link that they can cut and paste into the social platform that they prefer to use, that they can inform the contact of their risk. And the link within that message also links back to them, so we can track that they've been told and they've been signposted to services and they've been tested. The CVT system has very good contact statistics. And we do this by asking if the person diagnosed is there because someone else was diagnosed, also how many contacts have already been told and tested. And then we also identify how many more people they need to tell using the system that they haven't maybe told already in step 2 or 3. And then we also identify how many contacts cannot be told. And then with the follow-up and demographics, what we do is identify those patients particularly at risk of potentially progressing with COVID-19, so we can flag those for follow-up calls. But we also capture the gender, the age and the ethnicity of the individual so that we can fully understand how CVT is working with different patient groups. CVT supports testing centres to link specific contacts to them. It's like a digital hook. So what they can do is they can add time slots for specific patient types, such as asymptomatic or symptomatic contacts or patients with a COVID-19 diagnosis. And then they can determine if it's a telephone consultation, a triaging appointment, face-to-face or drive-through testing. And they can have as many appointment slots at that time as they wish, and they have full control. But we've also added in a new feature, which means that that appointment can either be released immediately or hidden completely, or we can have a time release. And what we've done here is allow clinics to book those appointments, and then say it's 24 hours before the appointment time, they can then get released automatically to the public, so they can then be booked, and we can maximize their utilization. And a summary page shows all the appointments that are being put out there, and those that have been partially booked, and those that have been fully booked. It's really important that we can sign off that the contacts have been seen and tested. And in CVT, we've done this in 4 specific ways. The first is if the contact books an appointment and they're not flagged as a no-show or did not attend DNA. They get counted automatically in the statistics. The second way we do this is by allowing the contact to self-verify that they've been seen and tested. And this is at the beginning of the digital triaging process. The third way is by putting in the unique partner code into the CVT platform. And when we do that, then obviously they're flagged as being seen by a specific venue. And the final way is for those clinics that aren't using CVT, we can use the URL shown here to put in that unique code, and then they can get signed off as being seen and tested. Patient follow-up is really important, and CVT supports this in a number of ways. The first is you can send a specific appointment time to a specific patient, and hopefully that works for them. The second way is we can send a link to a number of patients, and they can choose the time that works for them to book an appointment. And the text message they receive takes them to that specific clinic, and they choose that time, and then they get a confirmatory message. And then when we phone them up, we can look up that patient, and then we can actually identify how many contacts have actually been told, how many have been tested, but we could also add in manually how many other contacts have been told outside of CVT and have been seen and been tested. And we can then put all of this together in the statistics, and the analytics page will report that out in CVT. Now in CVT, we're able to demonstrate impact in real time. And on the analytics page, there is a filter that you can look at different time windows, you can look at different members of staff, and you can see the number of contacts that have been seen and tested for each person diagnosed with COVID-19. And on the summary page, you can see all of the work that was done outside of CVT and by CVT, and the CVT data comes back in real time. So you have up-to-date information to see where it's working. And this is how we can work together with users to make sure that we can deliver the best contact tracing solution possible. If you have any questions about CVT, then please feel free to get in touch. Thank you very much.